The threat of coronavirus spreading is something we've been talking about a lot, but now health officials at the highest levels in the U.S. and in central Illinois are buckling down to fight it. Good evening, I'm Paul Cicchini.
And I'm Jessica Coons. Today, President Trump announced a coronavirus task force. Meanwhile, health officials in central Illinois are doing what they can to be ready. Champaign-Urbana's public health district has entered what it calls full pandemic preparedness. They haven't done that in more than a decade since the H1N1 virus in 2009. WCIA3's Courtney Bunting is live in our newsroom. So Courtney, you talked with leaders in Champaign-Urbana today. What does that full pandemic preparedness mean?
Yeah, Jessica, that's a new term for a lot of us, but it means they're making plans on what to do if the virus comes to central Illinois. And part of that is by holding meetings with hospitals and doctors and communicating with the public on prevention.
This coronavirus strain is new, it is scary.
And it's on the minds of health officials across the world. Nearly 3,000 people have now died from the coronavirus, and it doesn't seem to be slowing down anytime soon. Public health officials in Vermilion County say they're doing what they can to make sure everyone has a plan in place.
So to employers, we're talking to them, it's like just try to imagine and make those plans. What happens if 10% of your workforce either is sick themselves or is home taking care of someone who's sick? What if it's 20%? Start to make those plans now.
President Trump is launching a task force dedicated to controlling the problem in the United States.
The number one priority from our standpoint is the health and safety of the American people.
While the risk to the American public is low, health leaders say the danger is still there.
Our containment strategy has been working. At the same time, what every one of our experts and leaders have been saying for more than a month now remains true. The degree of risk has the potential to change quickly, and we can expect to see more cases in the United States.
Now, a lot of people are wearing those surgical masks as a precaution to prevent the spread of the coronavirus. However, the CDC actually doesn't recommend that as a way to stop yourself from getting it. It's actually best used just for those who are sick and want to keep from spreading what they have to other people. Reporting live in the newsroom, Courtney Bunting, WCIA3, your local news leader.
And Courtney, let's put one of those numbers in perspective here. You said nearly 3,000 people have died from coronavirus around the world. How many people have actually gotten the virus, been diagnosed?
Yeah, Jessica, and that number is pretty high. There are more than 80,000 cases around the world, and the majority of those 3,000 that we talked about, those deaths have been in mainland China.
So the majority of people who have gotten coronavirus have not died. That number is still under 3,000.
Yes, definitely. Comparatively, it is relatively low.
All right, Courtney, thanks so much. World health leaders are working on a vaccine for coronavirus right now, but that takes time. They're still researching it. They expect to have something to test in about 2 months. Even then, testing is a long process and can take 6 to 7 months on top of that. So they're looking at about a year to a year and a half before that vaccine could actually be used.